be well with your health. I'm Nimeet.
I'm Shanna.
Welcome to the Adventist HealthCare and You podcast. Today, we're talking about all kinds of fitness trackers, which is something many of us wear every day. There's watches, bands, rings, and we wanted to see how these help us be in a better health and shape.
Nowadays, they're more than just fitness trackers. They're like health trackers. So
they are.
They've really changed. I do not have one. I'm curious about this conversation today.
Yeah, I have multiple devices, so I'm very curious about how that helps me, keep better track of my health. So, and we've got a great expert here today to help us explore this topic and how these fitness trackers can give us some insight into our heart health and how we can use them in a way that truly supports our healthy heart life.
All right, let's get right to it. We are happy to welcome Dr. Milan Patel to the podcast. Welcome, Dr. Patel.
Hi, good morning.
Good morning.
Thank you guys so much for having me.
Dr. Patel is a non-invasive cardiologist with Adventist HealthCare Cardiac Associates. Dr. Patel, tell us a little bit about how you work with patients.
I work with Adventist HealthCare Cardiac Associates both in inpatient and outpatient settings, as well as the ICU. So I see patients all over, kind of at all stages of their cardiovascular journey.
All right, let's get right to it. There has been a big rise in smartwatches, fitness trackers, health trackers. They've really advanced over the years. What are you seeing and how do you feel about them?
Yeah, of course. So I think in this increasingly digital age, data is power. And you're seeing watches, bands, rings, I think even maybe anklets, everywhere you see these smart technology and smart devices that help us kind of connect to the world. I think it really helps people connect to themselves. And it also helps them connect to their providers in a sense. People are seeing the benefits of tracking, not only their fitness, like you said, but also general health. And I think that gives them, the power to kind of see where they are at their stage in life and how to make changes to improve themselves, building on healthy habits.
I love that you said it helps them engage with their providers better. That's so interesting because you're right. If prior to all of this, if you just sort of were waiting for your blood tests or kind of just following those sort of types of numbers, you may not feel as engaged with what's happening. So that's interesting.
More intentional about their health. Yeah, they're more intentional about their health and they have the data right in their fingertips as well.
Yes.
But do you see all these devices as a distraction or an enhancement to people's care?
In my practice, I really value these tools. I think data, like I said, data is power, and any publicity is good publicity. Any data is good data, whether it's measuring calories, activity, steps, sleep, it can really give people a handle on their health and show them where they're headed. I think, all these health trackers, the main purpose for them should be recognizing patterns and seeing where you're headed. From a physician standpoint, it offers objective data points in a non-traditional way that can also contribute and help us to come to health plans and where people need to kind of see their health go.
How accurate do you think these devices are, in your opinion, when it comes to like measuring heart rate, cardiac rhythms, things along those lines?
So, I think in the industry, there's obviously, inter-rater reliability as far as tracking heart rate and during exercise, but also at rest. And they've gotten much, much better over time with repeat iterations and companies learning from each other, I think, as well. They're reasonably good at flagging irregular heart rhythms, things that as a cardiologist I'm looking at for irregular heart rhythms like atrial fibrillation and those smart devices with ECG features. Some of them can be less precise when estimating exact active calories or general total calories, sometimes off, by 10 to 20% here or there. But in general, it still gives you a good rough estimate of what you're doing every day.
I like it. It's pattern.
Exactly.
If someone wants to live heart healthier, or maybe, they have high risk for heart disease or has some risk factors that are concerning, or just wants to live heart healthy, what is some of the data that might be useful for them?
A lot of these health trackers are good at flagging active minutes of activity. And that's really crucial, whether you're intentionally, doing those activities or getting it every day, walking, steps, things like that. Things that we tend to look at a little bit more our resting heart rate trends, cardio fitness scores such as the VO2 max, things like that, which are strongly linked to long-term cardiovascular fitness and long-term health.
So there's a lot we can learn from this.
Yeah. You mentioned steps, and people think that 10,000 steps is the right way to go. I used to think that, and I decreased it to a little bit last year just because it was disappointing for me to see not meeting my goal every day. But what is, how can people think about a healthy heart life beyond the steps itself? Like what kind of daily activity or daily movement that they could kind of think or quantify that, this is probably a best way to have a healthy heart life?
I think the 10,000 step marker put out by AHA a couple of years ago, it can be a helpful, motivating benchmark, but sometimes it can actually tend to be a little bit hard to reach every day for people, especially when they're in an environment at work for 6 to 8 hours, things like that. But I also don't think there's a magic number as far as steps. Research actually nowadays suggests that 6,000 to 8,000 steps provides the same cardiovascular benefits long term. I think what matters more than hitting any exact number is building consistency and building over time. So say, for 1 month, we're getting on average, 4,000 steps a day. Let's try next month to get that 5,000 and then build on it and keep continuing to grow as much as you can to get up to those target goals and whatever's attainable in your life.
What are some recommendations you have about a healthy way to check your stats instead of obsessing over it, right? Like I had a fitness tracker a long time ago and I just, when I checked it at the end of the day, I'm like, well, I didn't reach 10,000 steps. And then I felt bad about myself.
Well, there's a mental health component to it where you're like disappointed on yourself.
Yeah, I know. And so it actually wasn't a motivator then for me. It became more of like a daily reminder that I wasn't doing what I was supposed to do.
A healthier way to kind of treat all this data that you're getting from these smart devices and fitness trackers is treating it as feedback, not as judgment. Focusing on the trends, the patterns, rather than those isolated single readings, and separate it from collection and analysis. For most people, a quick glance during the week, after a workout is great. And a deeper review, once or twice a week can actually help spot those meaningful patterns. Reacting to every dip or spike may not be productive, and it may actually impact your mental health, like you said. I think creating those boundaries, not checking all the time, turning off those non-essential alerts, and even scheduling a weekly kind of review can keep those data points useful without letting it become obsessive.
I like that. Not everybody can afford a fitness tracker, right? They come in all costs, all different types of connection. For those that don't have access to something like that, what are some ways that they can feel good about living heart healthy? Like what are just some easy things if you don't have access to something like that?
There was a time before all these smart trackers.
Yes, exactly.
What did people do? And I think it's important to sometimes go back to the basics. For instance, in the gym community, you still see a lot of people taking notebooks, writing down their workout routines. And I think that can be applied to everyday activity, whether it's, 30 minutes of activity here or 15 minutes of activity, there. I think keeping track of it, journalizing it, even if it's written down, can help you kind of spot those patterns and keep it relevant to your life. And actually, in some ways, it can actually help detach from, the incessant kind of...
you mentioned alerts. Yeah, turning off the alerts. And
all these kind of different signals that you're getting. But I think good old handwritten notes can actually, help if we can't afford these things or we just may not have access to them. So it's not to be exclusive. Everybody should have an impact in their cardiovascular health. And I think it's important that we promote that too. Yeah. Even in the office, I love seeing people bring their handwritten notes of, blood pressures or heart rates, things like that. I think it's great. And it gives them a sense that they're also taking a part and a role in their own health.
I love that. My husband takes his blood pressure pretty regularly. And he writes it on a notebook. He takes it to his doctor with him. And it's an easy thing. And I love that you can do it all, whether you have it as a fitness tracker or you're engaging with it just with pen and paper. It all works.
So you mentioned earlier, like the steps were not the, you don't have to look at one particular metric. Like, is there a particular metric or number that you do recommend looking at if somebody had to focus on one particular aspect of things?
Yeah, I think if there's one thing I definitely recommend, it's focusing on, weekly minutes of moderate, physical activity. I think that getting consistent activity throughout the week, hitting a target goal. A lot of research suggests 150 minutes per week. You can split that up how you need to. And I typically recommend to patients 3 to 4 times a week at least. That way it's consistent throughout the week, but you're also taking breaks. And it's not hitting that goal every day, but making sure to be moderately active, whether that's walking, running, low impact sports. I think a lot of people nowadays are on, pickleball fads, and that's a great way to be active, be engaging with, people in the community, and other activities like that are great.
That's great.
I love that. And 3 to 4 days doesn't sound as overwhelming. All right. I think we've covered a lot today on our fitness trackers. Anything else you want to add, Dr. Patel, before we close out?
I think that fitness trackers, health trackers, all these smart devices, they're really beneficial. And I think people should use them as a tool, not necessarily a diagnostic tool, but a tool that can help you engage with your own health. They're for providing, data for you and a lot of times for your providers. So I think it's a great tool to have if it's available to you, and any data is good data. Yeah.
And even in writing that down, it takes you from passive with your health to engaging and active and looking at the patterns and engaging with yourself and your physician.
Yeah, absolutely.
I like it.
I know I learned a lot today, so hopefully you
I'm
did
excited.
too.
Maybe I'll give it a try. I don't know. Thank you, Dr. Patel. You're a wonderful guest today. We appreciate your time.
Of course. Thank you guys so much for having me.
All right. Well, as always, you can find information about Dr. Patel today in today's episode's show notes. If you would like to learn and find out your risk for heart disease, you can take our free and fast heart health risk assessment at AdventistHealthCare.com. Love your heart. We'll put that in the show notes too. And as always, we'd love to hear what you think about the podcast and any particular topics that you want to hear more about. You can email podcast@AdventistHealthCare.com. Thank you as always, Nimeet. Thanks for being here with us.
Absolutely.
All right. Don't forget to subscribe so you get all of our new episodes. Thank you and be well.